Hi there, everybody. I'm Jeff Mayers from WisPolitics.com and WisBusiness.com in Madison. And we're here today with our virtual program, our first of the year, actually, Improving Youth Mental Health in 2025. And this is sponsored by Bridge and Build, Wisconsin. Also want to tell you that you can enroll in our free healthcare report that comes out Monday through Friday. You can sign up at WisBusiness.com. And Bridge and Build is also doing an event related to this at Lambeau Field. Sadly, the Packers won't be needing it for any more postseason games or anything by this time. March 17th, there will be a program sponsored by Bridge and Build and organized by Bridge and Build, and we'll talk more about that during the program. So we've got a great panel here to dissect this issue. We're going to try to have a conversation on the state of youth mental health right now and what can be done to improve it. I also want to give a notice to a program that was done in late December by the State Office of Children's Mental Health, celebrating its 10th year in existence. And that's an hour-long program. It has a couple state reps and it has other leaders in the effort from around the state. So you can find that at children.wi.gov. Okay, so let's welcome in our panelists. I'm going to start with Maureen Busalacchi from Medical College of Wisconsin. Maureen, tell us your job at MCW.
Great. So I direct the Wisconsin Alcohol Policy Project as part of the Division of Alcohol Policy, Prevention, and Research in the Comprehensive Injury Center at the Medical College of Wisconsin.
Okay.
So we support communities to reduce alcohol-related harm.
Thanks for being part of this. Okay, Dr. Mary Pfeiffer. Mary's a lifelong educator. Tell us your most recent post.
Sure. Good morning. Good afternoon, everyone, and thanks for joining us. My name is Dr. Mary Pfeiffer, and I've been in education for over 30 years, including in the correctional system, alternative education, and public school system. I recently retired from the Neenah Joint School District after 15 years as superintendent, so it's great to be here.
All right. Thank you. Okay, Debbie Patz from Bellin Health.
Yes. Hi, everyone, and welcome. I'm Debbie Patz, the Vice President at Bellin Psychiatric Center for Emplify Health. Thank you all for joining us.
All right. And then Erich Pfeifer from Maureen, Travelift, who's involved with the Boys and Girls Club in his area.
Okay. Good afternoon. My name is Erich Pfeifer, and I have the privilege to serve on the corporate board for the Boys and Girls Club of the Bay and Lakes region, which includes Green Bay, Door County, and Shawano.
Okay, great. I'm going to just start off by, again, we'll take audience questions near the end of the program. You can do those through the chat. But right now, I just want to sort of set the scene here for what the situation is. I mentioned the program from the State Office of Children's Mental Health. There's some sobering stats there, and I won't go through them all, but I think that we're kind of familiar with these stats, the more feelings of depression or not belonging, suicidal thoughts, or self-harming. And COVID sure didn't help, these stats. And so I guess my opening question is, it seems like it's a heck of a lot harder to grow up these days than when we grew up. I mean, is that really the case? Let's just start with Dr. Pfeiffer. You're muted. You're muted, doctor. That's okay. It happens.
Sorry. It's a real interesting question because I wonder how often in different eras have people felt that it's very chaotic and very hard. I think that when you mentioned COVID, and there were a lot of kids who thrived as they spent more time with loving and caring and structured families. But there are also people, young children and people in general, affected by spending time alone or in a chaotic and sometimes abusive and neglected family. I truly feel, and we'll probably talk about this, if basic needs are met throughout, people can get through a lot of things. And if they aren't met, then the most vulnerable are really going to be struggling. So being connected, living with purpose, believing that you matter and make a difference, those things are really important, I think, in determining how we're getting through situations.
Okay, let's go to Debbie. Debbie, what are your thoughts? Is it harder to grow up these days than when it was when we grew up?
I think it's hard no matter, again, what generation, but I do think it's always difficult. I think it's probably hardest for this generation that we're seeing right now as well, right? The post-pandemic. And we think about some of the stressors that they have. One of the things is they're fortunate there's more awareness around it now than perhaps a generation ago even. So they're fortunate in that aspect, but I don't know that that necessarily makes it any easier for some of the things that they may face. And I think our adolescents are expected to grow up sooner, right? They're talking early and earlier about what are their career goals and those types of things. And all of those things can have a great impact on the adolescents. So there are things out there, and they're facing technology, cyberbullying, things like that, that it's good for us to be mindful of, and how can we assist them with those stressors.
Okay, Erich, what's your sense?
Yeah. So with the new digital world, as the digital world has accelerated, it's changed all of our lives, whether it's more challenging or easier to grow up in some ways. There's challenges. There's some ways it's made it easier, both professionally and personally for adults. But going back to the youth, you definitely see an increase in mental health needs post-COVID versus pre-COVID. And, it's hard to correlate directly in some cases, just as Dr. Pfeiffer talked about, the challenges COVID provided to some youth. But it really seems that it's the acceleration of the digital world that is probably triggering more of the mental health issues, as we've seen a greater need in serving kids within the Northeast Wisconsin community.
Okay, Maureen.
So I have to agree with what everyone has said. I think every generation has their challenges. We certainly have seen from reports about what's happened to mental health as, our phones became more popular and more social media, and not really having a net gain for our youth on that with mental health issues. So I think there's a lot more that we need to do in creating a better environment for our kids to grow up in. And I know there's challenges in terms of the amount of advertising that kids are seeing, and sort of the lifestyle that is kind of put out there a lot of times in social media that's really unattainable and less healthy than what it, and less popular than actually is happening in our communities. And so that's a problem as well. So, glorifying alcohol or drug use and those kinds of things are not helpful for our kids.
Okay, so let's drill down on the maybe the culprits, the main culprits. I think I've heard here, and not surprisingly, some legislatures are cracking down on it, schools are cracking down on it, the phone and the easy access to social media, and maybe that leads to cyberbullying. Is the our mobile devices and the ease of access to social media, is this the main culprit for the sobering stats that I mentioned before? Let's start with you, Erich.
I definitely think it's a part of it. I think also today, we also look at, basic needs being met, right? That's also a really critical piece, with making sure youth have, good meals, in a positive environment. And with inflation and everything getting more expensive, parents having to work harder, more hours, multiple jobs, that's all part of it. So it's not all digital and social media, that's a portion of it, but I think the basic needs being met is a very large part of that equation as well.
Okay, Debbie.
Yeah, I agree. It's one facet, right? It could be one of many facets or multiple facets that can contribute to mental health. So I do think it's one, and I think it's an important one, because that's really the world that our adolescents live in. So it would be great for us to look at how do we leverage that? How do we leverage technology? How do we leverage AI? I think about the different apps that are out there that can help, for example, with how to meditate, how to calm, those different tools in their toolbox to help them. And I think about how could we advance those type of measures in a world that they're familiar with technology for good to help our adolescents.
Okay, Mary.
I would agree with what Debbie and Erich have said. I think sometimes we don't fully understand technology because it's developing so quickly. And Debbie had mentioned AI. So with the development of AI, I do think that there has been a significant impact, like on social media, students comparing themselves to each other, attempting to find ways to belong and matter that may not be the most beneficial. If you haven't read The Anxious Generation, that is a book that I'd highly recommend that is kind of develops what you've asked, Jeff, about what is technology doing and how is it helping or not. But then it also talks about parenting and helping our children play more, taking risks without, I'll say, protecting them in the appropriate manner. And so if you haven't read The Anxious Generation, I think it's really worth your while, even students, to take a look at that.
So what was the Neenah School District policy when you were there in terms of use of phones, or could students have them in the classes, or did they have to check them at the door?
Initially, we did start with them using phones in the classroom. And at that time, some of our teachers wanted them to use it for purposes of education. Until then, we shifted to one-to-one, which was in 2017. So we were kind of ahead in that way. More recently, they have...
I'm sorry, what does that mean, shifted to one-to-one?
Oh, I'm sorry, one-to-one technology. So all students had a device in 2017 that they could use that the district purchased for them. So it was,
I see.
Yep. And that was K through 12 at that time. Since then, however, there have been significant conversations about students having phones in their classrooms. So now what our staff members are doing is you mentioned check them at the door. They put them in different little pockets that they keep them in there. They can't use them in the classroom. I believe they are still using them on breaks, but our students have given really interesting feedback that they do appreciate not having to look at their phone if they have it, or not feeling the vibration of a parent calling them or texting them during class. So I think the students are beginning to shift as well, with, of course, adults creating that expectation.
Right. So, Maureen, should we blame our Apple and Android phones?
So this is not the area of study that I am in as much. I just know that there's, of course, I've got my own kids and see impact, read, some of the reports. But what we focus in on is kids' perception about alcohol and drug use. And while overall rates of underage drinking, for example, have dropped, we are still persistently above the national average. And when we've asked kids about their attitudes towards binge drinking, Wisconsin youth tend to think it's okay in higher numbers than the rest of the country. And so that's not good, because there's this kind of co-occurrence or link between mental health issues and alcohol use in particular. And alcohol is still the number one drug used in Wisconsin, both by our youth and adults.
So what sort of strategies do you recommend to, I guess, combat, those attitudes?
There's a number of things that we recommend. And this has come up again and again, but state alcohol policies influence both adult and youth binge drinking behaviors. So how we as adults create alcohol environments around our state really impacts our kids. And there's some things decided on the state level, but we are very much, locals are in control of licenses in terms of how many alcohol retailers are in their community for the most part. There are some that come through the Department of Revenue that are permits that can be in local communities as well. But all of those decisions about how many licensees that you want, whether or not you do alcohol age compliance checks to make sure your retailers aren't selling to kids, and how you treat, underage folks when they are caught drinking and how you deal with that is really critically important. And just one other note, somewhere about between 9 and 10% of our sales are to youth in our state and across the country. So we do have an issue with retailers selling to kids. And that sends a message, like it's okay to go and do something illegal, right? So it's really important that we really think about that both locally as well as the state.
So how do you, I'm staying with Maureen here, how do you link, or what is the link between drug and alcohol abuse with youth and feeling anxiety, depression, self-harm, suicide?
So there's a lot of research that's being done, and it is associated, really alcohol impacts normal brain development and cognitive functioning. And it can have adverse effects on normal brain development, such as risky sexual behavior, physical or sexual assaults, injuries. Alcohol use disorder can come even in your teens, as well as blackouts, alcohol overdoses, and unfortunately even death. So alcohol's impact on the brain is pretty significant. And even if you're not like our kids generally aren't drinking every day, but when they do drink, they tend to drink a lot more. That can have a lot of adverse effect. Even one session can have an adverse effect on brain development. So preventing kids from drinking is really important. It's not a rite of passage, but rather something we need to be really on top of. And it is associated with mental and physical disorders.
Okay, Erich, I'm wondering what kind of what you see, I guess, on the ground, with the clubs, the Boys and Girls Clubs.
I don't really have a window into the alcohol and drug use with youth and how it affects them, where the numbers are. Really, my window is just seeing the increased need of mental health support in the youth. I don't have any line sight into the alcohol side of things.
Okay, Debbie or Mary, something to add from what Maureen said? Go ahead, Debbie. I see you nodding.
Yeah, I agree with Maureen, and really individuals' brains, they take until you're 25 years old to fully develop, right? So even the legal drinking age of 21, their brains are not fully developed. And we think about even a healthy adolescent, they are typically more impulsive. They're still trying to figure out their footing and how to be a adult or a semi-adult in the world. And then you throw in alcohol, which can have a significant impact, or drugs that can have a significant impact. We do see that on the rise in our adolescents here in Northeast Wisconsin. We do get more requests to help care and treat for adolescents. I just got one last week with one of our local counties on how we can assist with this. So we do see it more, and it does lead to things such as increased depression in adolescents. Self-harm is something that we see more too with drugs and alcohol in our adolescents, and that's often an early warning sign for suicidality and other mental health issues as well. So it definitely is a problem, and it's definitely something that we need to continue to work on.
Mary, do you have something to add?
Well, I just add, I think at the school level, what's important for us is collecting data and screening for those behaviors. We have great teams in place. We have counselors. Neenah, I'm proud to say, has a mental health coordinator, and we have since 2015, which a lot of districts don't, thanks to the Board of Education who supported that. But signs of suicide screener help us identify students from 6th through 11th grade who might be experiencing depression and suicidality is just what Debbie had said before. And then we do have our SABRS screeners, so the social, academic, and emotional behavior risk screener for students in grades K through 12. And that has been very useful information as we've made decisions in district and supporting students and families. And then lastly, the YRBS data is through the state. So youth risk behavior data, that is also important as our teams make decisions on behalf of children.
Right. So, okay. So schools and organizations like the Boys and Girls Club that's where kids and treatment can intersect. But one of the findings from the surveys reported by the Office of Children's Mental Health here at the state was that half of kids who need treatment don't get treatment, about half. So how can we improve the access? There was actually one of the state legislators who was in the program conducted by the state office, Representative Snyder, wondered about whether there should be mental health screenings for kids in schools, maybe as early as age 5. Again, is that a good idea? How do we get better access for people? Because there is a cost barrier too beyond school, right? So who wants to tackle that one?
So I'll start.
Oh, go ahead.
Please go ahead. Please, thank you. So I'll start by saying, I think there's a lot of great organizations out there, Boys and Girls Club being one of them, that does a great job with its members, helping them with mental health issues. But in a lot of the cases, not all the cases, they're almost like, think of them as a first responder, right? Like they're able to, address some of the the needs, but maybe not all the needs, but be able to, keep everything in line until they're able to get to somebody who might be able to help them at a different agency level. But from my perspective and our perspective, you talk about access, and I feel like the mental health arena, if you will, there's just not enough counselors out there, right? It's no different than a lot of businesses. People are looking for machinists or welders or salespeople or whatever your business is. We just need more help with more people and having that skill level. And to me, it's a much deeper issue. It's not an access issue. You can't just throw a bunch of money at it. It clearly needs money, but throwing more money at it doesn't necessarily solve the problem. To be able to solve the problem, we need more people going into mental health counseling. And, as part of that, there's need, there's purpose. It can be very rewarding. But there also has to be remuneration for those people as well to make them, have them to be able to go into that field and have a great career and a promising career to be able to provide for their families. And I think there's a little bit of a disconnect there. So I say you can't just throw money at the problem. It's not like, hey, we can get more money, you can get more access. We just need more counselors. And until we fix that root problem, I think it's going to be very difficult to actually fix the true challenge to access. And in the meantime, I think the shortstops are wonderful organizations that can act as first responders, if you will, to diffuse some of those situations.
Okay. Debbie, go ahead.
Yeah, if I can add to Erich, that was a great segue to my thoughts as well, Erich. So from a healthcare standpoint, yes, we do need the services reimbursable. So I think about our Bellin Psychiatric Center and children with Medicaid. That is different in a freestanding psychiatric center or hospital versus others. And there's a bill that was passed this past year at the state of Wisconsin level, which will now allow us to serve them and be reimbursed. And that should be available to every child everywhere, right? Mental health services should be reimbursable. So I do think that's a very important issue that does need to continue to be looked at.
So I'm sorry, what does the state law do again?
The bill was signed last April, and it allows for children with Medicaid to be able to be hospitalized in freestanding psychiatric hospitals when needed. Prior to that, that it was not a reimbursable service.
Okay.
So that is a huge change. And we need to continue to look at where there are limitations for our children, for our youth to receive mental health services. And we need to make sure that they're reimbursable as they are for every other child, irregardless of what type of payer they have, insurance they have.
What you're saying is cost should not be a barrier to this.
Correct.
But let's face it, it is.
It is. So let's take a look at what those differences are and how do we correct that or rectify that.
Okay, Mary, I guess I'm going, anytime there's a school question in my mind, I'm going to go to you. But think about this. It was recently reported that Wisconsin requires every school to have a school nurse. Okay, but most are part-time, and 25% of the districts don't even have a nurse. So, like, who is the trusted adult, for the kid who thinks who has trouble or needs to talk to somebody, right? Who is that in some of these schools? Neenah is pretty big district, pretty staffed up in terms you've mentioned some of the things, but what about some of these other schools?
That's a really great question. I think oftentimes people underestimate everything that's happening in our schools. They are our adult mentors, I should say, our adults become mentors to children who create that trusting environment. I mean, let's face it, they're with us 180 days, a lot of hours, and we need to create a safe environment for them while they're at school. I feel that we can't underestimate connections. When children or even adults feel safe to be with someone, they're going to open up. They're going to talk about their friends and help their friends if something would be endangering to them. And then I think peer-to-peer engagement is also critical as we create that community to support all of our kids. We also, I think, need to depend upon our communities. So as adults, how are we helping our children? Even if you're retired or you don't work in the school system, have you reached out to ask, how can I help a child in need? I mentioned our mental health coordinator who does a phenomenal job. And unlike some smaller districts who may not be able to afford that, but he sent me an article related to the Maasai culture. And their main question before meetings is, or in their tribe, how are the children? And how often do we ask, how are the children? Because if we can nail that answer and our children will be well, then as they grow, right, our correction systems numbers should decrease, our mental health numbers should decrease. If we can tackle and I'll say save our kids, all kids, providing them access, like Debbie said, then I think we have something that's going for us. And Erich and his work, as well as all of the other outside organizations, when within the community, are truly important partners to help bridge the emotional balances of our kids.
Right. It seems like there's a task in knitting this all together, right? There are organizations helping that not every community has. All the organizations that, that Erich's area has, or Neenah's area has, or Greater Green Bay area. So I do think that there's, rural parts of our state have, different levels of access to treatment. And I think that, that's been discussed a lot at the state legislature too. So I'm not sure what exactly the answer for that is. Again, schools are intersecting with the kids, at least 180 days of the year, right? So they're a focal point.
Right. I'd add one thing. I think that, and our legislators are talking about this, but we have to get rid of grant programs for mental health. For many years, we had to apply for grants to help support mental health in our schools, and that can't be. For our rural school districts, oftentimes superintendents are not only, and they're maybe one counselor or a half a counselor, they're dealing with all of the situations. But how can we provide resources that are going to be used to create systems of support, because we have to create a system that will then help us to serve our kids. It's complex and it's hard, but I think we have to get past grant funding and we have to provide, I would say, at least one person in every district, no matter how small it is, that they are focused on systems of support for children.
So are we talking about the school counselor? I mean, not every district has a school counselor, or is that what you're saying?
Well, I anticipate all schools have a school counselor. I don't know if there's a district that doesn't have a school counselor. I've never heard that. I guess the tough part about just sending things to the school counselor is that
They get overwhelmed.
I'm sorry?
They get overwhelmed.
You get overwhelmed. And then they really can't do the work they're supposed to do. Um, it's a funding issue, I think. When I talk about what we have done in creating systems, I think they have made a difference, but I think we have to reach all of our schools and not just an umbrella like DPI. They cannot serve every school the way they need to. We need, I'll say, boots on the ground at our schools for all kids.
Okay, thanks. Maureen, do you have something to add on access for, your arena, drug and alcohol abuse, or how that should be disseminated to youth?
So there is a great tool called SBIRT. It's Screening, Brief Intervention, and Referral to Treatment. And that tool really helps screen for risky substance use. And many folks are not at an alcohol use disorder level or where they need significant treatment. But we found that when SBIRT or SBIR, where there's not the referral to treatment, that brief intervention where someone who's trained in these techniques can really help people re-examine why they're using a particular substance, especially, of course, alcohol. And so when those kinds of, it's called motivational interviewing. So when some of those kinds of things are given to kids, especially, that can be a way of helping them figure out how they want to go forward in a more positive way. It is not the answer for everything, but it can help. And what it needs is to have folks that are trained around the state in a variety of different places. So schools is one place where that could be a very useful tool. We found we have court systems across the state of Wisconsin that are using it. So that first underage drinking ticket, hey, let's sit down and talk and try to work through this so that we can prevent the need for treatment later on, at least with substance use, right? And of course, within our healthcare system, some have some form of it, some don't. It does take some resources, but the studies have also showed significant savings in our healthcare system when these models are applied. But it does take that investment of having your people trained in it or a health educator available. But that is definitely one piece because our work is totally about prevention and trying to reduce the need for that treatment and more counselors. We need both, obviously, but the more we can prevent, the better it can be. And the demand for alcohol treatment in our state is off the charts. And we don't have the capacity to handle it.
Okay, so again, the state office stresses some things that can help, right? Increase a sense of belonging, have a supportive adult available, and increase of friendships. So COVID certainly didn't help any of these. And I think parents were the parents were overwhelmed too, right? I mean, they couldn't, they're trying to get their kid to do the Zoom class or fill in and do your parenting job too. What sort of advice would you have for parents here? We're still getting out of the effects of COVID, but what are some of the strategies for parents? Why don't we start with you, Debbie?
Sure. So I think some of the most important things are really, again, getting to those basic needs and then communication, right? So it may feel awkward, it may feel uncomfortable, but also you know your children best. And oftentimes when children are struggling, there are signs when you look back. And so it's just really important that even if they're teenagers, if they're rolling their eyes, if they say, if you ask this for me one more time, this is just silly, it's still important to keep that communication open and that discussion. And it's okay as a parent even to say, I'm struggling with how to handle your behavior, or I'm struggling to understand you and what's happening. And I think it's just really important that kids see, they may not always reciprocate it in a way that we would expect, but they at least have the potential, and they see that there's a loving, caring adult parent that cares for them. And that's a start to it, right? And from there, it grows.
Okay, who else wants to chime in on that?
I could chime
Go
in
ahead.
briefly. I think it's really important how parents are using substances. And, if you're drinking every day, that's sending a message to your kids. So try to make sure that you have, whether it's dry Mondays or dry during the week, or, whatever works for you and your family. I think those are really important signals to go and, be at events and not always be partaking in drinking alcohol. And of course, any other drug use. Again, your kids are watching. And it's one of those things, you can tell them one thing, but if you're doing another, it does send that mixed message. And obviously, if you need help, I hope folks are able to avail themselves.
Mary, you want to chime in?
Yeah, I would add, because I agree with what Maureen and Debbie said. I think talking to your children, and when you ask them how their day went, and if they said it was just fine or nothing, we didn't do anything, right? Drill down and ask them, well, tell me more about that. Tell me more what nothing is, or
Right.
and maybe not use your phones at your table while you're having dinner, if you have dinner, because many times, they're kind of in and out dinners. I think for parents to stay connected with our schools is really important. Ask for help if you need it. We do have support at our schools for our parents as well. And then encourage your children, if possible, to get involved in something, a co-curricular or a club, something that they're engaged in a different way outside of school, because we found those students who are engaged in that way have the support of another advisor or a coach, and that's oftentimes very helpful to us.
Yeah, Erich, you have something to say there, because I'm going to go on to an employer question, but go ahead.
Sure, I'll just echo what Debbie had to say. Don't underestimate the importance of basic needs and the stability and foundation that can provide for a kid for success. Really critical.
Okay, so we're talking about kids who are going to become future employees, Erich. And I'm wondering this connection between mental health issues and the employees that you and other employers in your area must see. What's the connection between what can be done when they're in school so that they become better employees?
Great question, Jeff. The youth are clearly our future employees, future generation, future for our, state, country, and world. And one of the things I think is really important for the schools to make sure they can also teach the kids through the mental health piece is conflict resolution. One of the things that we see with, whether it's apprenticeship or, people that are earlier on in their career, is they might not have the skills from a conflict resolution standpoint and not being able to resolve conflicts. They're not like aggressive conflicts by any means, but just day-to-day, average type conflicts that can create internal stress and anxiety in youth and young adults. I think that's a really important area that schools and colleges are overlooking right now from teaching curriculum.
Okay. Mary, any thoughts on that?
Sure. I think that schools in general are focused on critical thinking skills and the importance of that. We've heard from our employers loud and clear that they need to be problem solvers because the jobs that we're training them for, if you train them for jobs, we don't know what they're going to be doing 10 years from now. So there's going to be so many new jobs. But they do have to be creative listeners. They have to be creative thinkers as well as using those critical skills to solve problems. I would also say when it comes to conflict resolution, let's be models for our children. Oftentimes we see in our society how and even on social media, people are just saying terrible things about one another. I tell people we teach our kindergartners that they should be nice to each other. And so when it comes to that conflict resolution, let's be models, and then let's set the stage for them to really deal with conflict and resolving some of those in the classroom and get rid of that emotion. So those are also factors that we deal with usually daily.
So okay, so but Debbie and Maureen, maybe we now talk about what is the problems that may exhibit themselves in youth become exacerbated as people grow older. They just don't go away, right? So I mean, I guess this is why we're concentrating today on youth mental health because, well, treat it now, not later, right?
Yeah, absolutely, Jeff. I think again about the brain development. And so if you can help them while they're young, that makes such an impact. I think about trauma-informed care too, right? So to your point, these just don't go away on their own at all times. So that's the best case outcome, but it is not the most frequent, right? If it's not addressed. And typically they tend to snowball and lead into more dangerous, more harmful type of mental health. So it is important for us to try to catch it early. And I think some of those are things of life skills, working with kids early on, and also knowing that if they're anticipating one outcome, there could be a variety of outcomes. And how do we help them navigate it when life doesn't go as they think it should go? And that's a skill that many of us pick up as we mature through adulthood, but that's really hard for our adolescents, right? And it's something that they all have to go through. But how do we help them ease through that learning so that it's not so difficult for them?
Yes, in terms of youth, there's studies that show that if kids are under the age of 12 for their first alcohol use, their lifetime alcohol dependence rate is 40%, almost 41.
Wow.
If it's 18, which, there's a big gap between 12 and 18, it's almost 17%. So if we want to reduce alcohol use disorders and other substance use disorders, we really have to pay attention to youth alcohol, tobacco, marijuana use. Really, it's all of them because of how it impacts their brain. And so it's one of those things that I think families really need to take seriously, especially that young. And Debbie mentioned earlier, the brain development going on into your early 20s. So these are really important factors to think about. And in terms of your own as an adult alcohol use, but that impact on kids and like, oh, gee, it's funny, but it's really not. It can be quite serious for some of our kids. And so it's important that we, as a society, say, you know what, we've got to button this down. We want to prevent folks from having alcohol use disorders and any other type of substance use. And especially, most folks don't start out using opioids. Again, it generally starts because of early alcohol, tobacco, or marijuana use.
Okay, audience, we're going to, I see 3 questions in the question queue, but you're welcome to put in some more questions and we'll try to get as many as possible. But before we get to the questions, I just want to ask this overall thing. Okay, I talked about the State Office of Children's Mental Health. Okay, and there has been legislative activity surrounding these issues. But what more can government do, or what more should government do? And I'm not just talking about the schools, I'm talking about the state, many of the counties, handle all kinds of health issues. And then you have, city health departments as well. So what more can government do? Maybe if nothing else, then to um, get people out of their silos and coordinate these activities. Any thoughts on that? Who wants to take a stab at that? Mary?
Sure, I'll jump in.
Okay.
Some of these things are, available now. Like I talked about earlier, making sure that retailers aren't selling to our kids. And most retailers want to do the right thing, want to follow the law, right? But making sure that we have those checks, those alcohol age compliance checks. So there's not a lot of, there's basically no state resources to support that. But there are communities that are doing it, and that's, a good first step. Also supporting expert, like I talked about earlier, making sure that schools, our court systems, and our healthcare are, able to utilize that and providing resources if necessary can be two major helps in reducing, youth use of alcohol.
Okay, Mary, since I'm talking beyond schools. We've laid a lot of obligation at the doorsteps of the schools, but what else can governments do?
Well, I think really that's a tough one because, as Erich had said before, just putting money into something without creating a systems approach isn't going to make the biggest difference. I think that our community resources at the county level should be increased. They've been reduced significantly. I think partnerships with our community organizations, the YMCA, Boys and Girls Club, our churches. In Neenah, we were fortunate to work with U2 Behavioral Health, who are they're inside our schools, Reach Counseling, Innovations, A Healing Place. Those are all organizations that I hope will continue to be funded in some way. But it really needs to start within the community and raising an awareness and support by all of the individuals in the community. Now, what does that mean from a monetary standpoint that the legislation can do? I'm not sure. I think Maureen mentioned alcohol, vaping. There's usually jurisdictional issues when it comes to vaping now that their kids are fined, but fines really don't help either. For some it does, but I think we as a community need to, and as a state, prioritize children. And if we can get to them, again, if our children grow up feeling a sense of connection and a self-worth and that they have the tools to make them a difference, that will change a lot of things. And I think that there's a lot of doubt right now in some of our kids that they don't know where to go.
Okay. I think there is greater awareness. And I think, although I heard somebody joke, well, greater awareness, but please don't self-diagnose on TikTok. So, yeah, I think that it's like channeling this awareness into fruitful treatments and progress. Okay, I'm going to go to some audience questions, and we won't all answer each of these questions. I think it may be, I'll try to pick the right person so we can get through them. So here's one. How do we reach the young adults who aren't able to ask for help, especially the angsty teens? Debbie.
Yeah, that's not an easy answer, but I think about we really have to go to their environment and where they're comfortable. So school is one, right? And that's the obvious one. But I also think, how are there ways that we can encourage more peer support? We have highly intelligent youth. They are going to lead us someday in our own communities. And I think that they probably don't get enough reward for when they do recognize that something's different with their friend, for example. So how do we support some of the peer groups that can happen, as well as I think about how can we create environments. I know we're working on an adolescent clinic currently, an area, a space for them where they're more comfortable with some of their health questions. And I think that that's really important as well.
Okay. Thanks. I'm just going to move on to the next question here because we're going to try to end around 1 o'clock like we promised. Okay, how can we as a society do a more effective job at recognizing behaviors that lead to youth mental health violence, such as the recent school shooting in Madison? Now, the motive for the student who perpetrated the violence, I don't think that that's been released or found by police. This was at a private school in Madison, and I don't know what I think that some people view that, well, that's like outside the bounds, that wasn't a public school, but it's still, we're talking about kids in Wisconsin. So I'm wondering, let's just try to answer that question without knowing all the facts associated with this particular incident. Mary, do you want to take a stab at that?
Sure. I think, unfortunately, we have to talk about school safety and school shootings and train our students to respond to violence. And we never had to do that. We were, talking about tornado drills. I think that a key element is knowing your kids, being connected. Oftentimes, the kids who show up, and not all the time, of course, they're not really connected or they're loners. See something, say something. We didn't mention today, but that's something that has been very instrumental in helping us as school districts resolve issues before they're known. It's an anonymous tip line, and that's been very helpful. I think that, again, if we can connect all kids with an adult mentor, having them feel safe, knowing that all of their basic needs are met, I think that will be helpful. Is it going to be 100%, it's not going to work 100% of the time, but I think that would really help create a we culture instead of a me culture that sometimes exists.
Okay. Here's one. What specific community outreach programs do you suggest are you using to help assuage the fears of, quote, woke indoctrination in this current political climate? So I think that we can't, I think somebody said on another question, this is the world in which we live. Well, this is the world in which we live. So does that have to be a consideration, I guess, of this effort to improve youth mental health? Anybody? Or you don't want to touch that one because I said political. I'm so, sorry. I was reading somebody's question, so.
So we don't consider that as part of the work that we do in alcohol and in alcohol prevention. But I have to say the work that is most effective is really cross-sector. So it's involving law enforcement. You're looking at coalitions working to reduce substance use. We're involving healthcare. We involve schools and community members. So I don't know any community that, can bring all of those folks together, and people that are really interested that are looking, with some political viewpoint. Really what they're trying to do is like reduce substance use in their community. And there's a variety of things in order to do that are effective, that we have great research about. And so that's kind of how we work in terms of preventing, alcohol use, especially with our kids. So I think it's really important that we're bringing people from all different parts of the community together to be part of these efforts. That it's not stamped with anything, but it's, looking at the evidence and doing the things that we know will work, I think really helps that. And we've had a lot of success, and we have all kinds of different people involved. We're not looking at their political standpoint.
Right. 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 The mission, if the mission is to help youth mental health, that should be able to cross a lot of partisan and cross a lot of partisan lines and break down a lot of silos. Okay, here's a question, or maybe a series of questions from Michael, one of the attendees. I would like to know what we as Wisconsinites are willing to do to support kids' mental health. Are we willing to help out with meeting basic needs like free lunches at school, supporting daycare for parents, parent education to help prevent substance abuse, free healthcare for children, enough resources to respond to child abuse and other family support, funding for foster care? So Michael's advocating, I think, and we've touched on this, that there are programs out there, but they're not well funded enough, or there's not enough. They're not reaching everybody. So again, how can again, this is kind of a private sector mission as well. So Erich, I mean, how can the private sector, I guess, help with outreach, extending the safety net, so to speak, for youth mental health?
I think from a private sector standpoint, it's really important for businesses to, be partnering with local organizations, similar to the ones that Dr. Pfeiffer spoke about earlier, Boys and Girls Club, YMCA, the churches, Big Brothers, Big Sisters, all the various organizations within your local community to make sure they have the support and financial resources so that they can work at a community level to make sure that, basic needs are being met. I think that's a really important part of it. And one part that hasn't really been talked about, and I think it's a great question, is the daycare for working parents. And I'll kind of go back to, from a government standpoint, question you asked earlier, Jeff, about what can the government do. And I think ultimately it comes down to, more consistent and more stable funding, not a funding for 1 year or 6 months. I think the government, if people are listening to this, need to think about, 3 to 5 year horizons from a commitment of funding, because then the proper resources can be invested in. People can plan from a career standpoint much better that way, entering these areas. So I think that stability from local community support from businesses, as well as the stability from local support from government, is really critical to checking all those boxes, because those are all critical issues that have to be addressed, that can be addressed through funding.
Okay. Well, before I go around for the final thoughts on maybe your hopeful thoughts about this issue, I'm going to read this comment. I'm worried about the amount of lift being placed on the youth who are already showing signs of stress. See something, say something, train for violence drills, peer-to-peer support groups. How can we expect youth to build the airplane to fly them out of this crisis while they are in the air? So I think that is like, what is the capacity? We always say youth are resilient, right? And they are. But, at a certain point, that, they can be overwhelmed too. So when we do our closing thoughts, maybe muse about what, how we could, lift the burden on some youth. But I guess maybe we can end with hopefully a, positive note or two. So Maureen, you want to start off? You're a generally good person.
Yes. Well, we are seeing decreases in underage drinking, which is great, and other substance use. So we still have a lot of work to do, and it's really about prevention. So I think that's kind of part of that question is, what do we do to prevent pieces? And I feel like there's much more awareness and support for a lot of these efforts, and that makes me hopeful for the future.
Okay, Debbie.
Yeah, I see there are so many, today we heard of so many different components, right? And it is multifaceted. And for me, it's exciting to hear the different things that are happening. And then also, how do we get together to continue to advance each of those areas? Because it's not just one per se that's going to do it. So to answer the gentleman's question about how much can we expect of the youth, that is one facet of many to support our youth throughout. So for me, it's very exciting to see that so many people have awareness about the importance of mental illness, especially how important it is to work with youth early on. And I think that gives me a lot of hope in how our youth continue to grow and develop.
Okay, Erich.
Just to be able to explain to the youth about the great opportunities that can be there in the future for them, right? When you're in a tough time, the adults, mentors, explain to them all the wonderful things that are out there in the world and what they can become with a little bit of hard work and dedication, and those opportunities that are possible. If we don't explain them to them, they might not know that they're there, and those opportunities give them hope.
Okay. And Mary.
Yeah, one thing we didn't talk about is the importance of student voice. And oftentimes, as adults, we come up with a whole bunch of things that we think we should do, and we don't ask our children. And I think if we can begin to put some ownership and agency within our children, they will rise to the surface, and they will rise very quickly and very high. I think asking them to share their voice and giving them the opportunities to help their schools and communities feel different is so important. So I think sometimes we minimize student voice, and I think we need to start building that up even more.
Okay, Mary, well, we have you. I'm going to give you the closing words. Bridge and Build, an organization you're involved with, is staging this youth summit at Lambeau on March 17th.
Right.
It says leaping into hope, health, and strength. So, what do you hope to achieve on March 17th?
Well, our ambition is to bring 1,000 high school students together from Green Bay, the Fox Valley, and the surrounding areas to the Lambeau Field atrium. And for some students, they've not been to the Packer Stadium, and that will be a gift in itself. There's no cost to the districts except to transport their students there and to have an adult mentor. But we're going to help them recognize that they can make a difference in their lives and others, and then leaving with a shared vision for hope, health, or help and strength, as we also have a call to action, because oftentimes what's missing when we have these events is what's next. And so our ambition is to then bring adult mentors and do some training in August to help build what that program is going to be in their school. And I shouldn't say program, but a way of being that will help students feel that they've been lifted up along with their adult mentors. So if you are interested, we do have a website. It's Bridge and spelled out, build Wisconsin or wi.org, bridgeandbuildwi.org. So thank you for considering taking a look at that.
All right. And thanks to the audience and thanks to all of our panelists. Really appreciate it. This is the kind of topic that 1 hour-long program isn't going to solve, but I hope we've reached some people with some good ideas and solutions. And as I said, for more, you can go to the office of the State Office of Children's Mental Health at children.wi.gov. So thanks very much, everyone. This is Jeff Maris from WisPolitics.com and WisBusiness.com signing off, and we'll see you at our next event.